Hello, ladies and gentlemen, and welcome to another video at the Pharmacist Academy. Woo! Now, before I even dive into this video, I hope you guys are staying safe and healthy during this COVID-19 pandemic. Now, try your best to stay inside, please, unless you really have to go outside, and wash those hands. Now, in this video, I will discuss what infusion rates are and then walk you through 10 practice questions. If you had issues understanding infusion rates in the past, that ends now. Now, before we begin, don't forget to subscribe for more pharmacy related videos just like this. So, what are infusion rates? Now, let's break this down. Rates has a relationship with time, right? So, infusion rates is just saying what is the relationship between this medication and time. And usually when they say this medication, they're referring to like IV medications, right? A bag of solution that's given into the patient's vein usually over a certain amount of time. So that's exactly what infusion rates are. Now, infusion rates can be adjusted based on many things. So that's one of the beauty of being able to like infuse a medication into a patient's vein, because some of them you could adjust the dose, right, based on the patient's blood pressure. Is it too high? Is it too low? The patient's pain response. Is the patient well controlled on the pain or not? If not, then we will give the patient more medication by increasing the infusion rate, by increasing the amount of medication the patient would get over a period of time, right? Or toxicity or efficacy. So that's one of the benefits, and that's something we can't do with oral medications usually, right? Like you can't titrate how much the patient is getting right there in order to change the effect. Now, infusions could be bolus, so this is usually a large amount of medication, and that's usually given over a small interval of time. I've seen medications in oncology where it's not like a large amount of volume, right? The volume itself may be small, but the amount of medication the patient is getting, that's usually large. So that's what it means by here. The medication amount is large, but it could also apply to the volume of the bag is big, right? If it's high, and if you give that over a small interval, that's a bolus. Then you have continuous, where you're giving it over a slower rate, little by little, over an extended period of time. Then we have intermittent. Now, intermittent is just saying how often should the patient get this, right? So yes, the patient is going to get this IV medication that's going to be infused over 1 hour. But how often are you going to give this patient this medication? Maybe it's every 8 hours, every 12 hours, once a day. But that's a little different from the infusion, right? The infusion time itself. Now, here's a picture of an official New York State board label for the IV preparations. We have the patient's name here on the top, the room number, and the additive. The additive is usually the medication itself, the active ingredient. So let's say vancomycin, 500 milligrams to a solution of normal saline, for example, or dextrose. And here's the infusion rate expressed in volume over time, okay? But it could be expressed in many different units, and we will see on the next slide. And we also have it in drops per minute, preparation day, expiration date, the time, the doctor. As you can see, the label has a lot of parts you need to fill out. So just make sure you pay attention to it and make sure you fill out everything, because last thing you want to do is lose points because you didn't write something on the label, like, you know what I mean? So make sure you just double check that. Now, infusion rates, like I said, could be presented in many different ways, and you must know how to convert among these. So usually they provide you with the right information to allow you to convert from one into the next one, depending on what the question is asking for, really. As you can see here, we have the volume over time, then we have amount over time. Amount over time can also be presented with the patient's weight in there, which also could technically be done with the volume over time also. But that's just another way. It's like an extra step, really. It's not difficult at all. It's just an extra step. So think of it like that. So for the practice questions, it's set up just like this, right? You're going to have a prescription here, and it's going to have the patient's information here, and then the medication information right here with the dose. It also tells you what kind of bag, right? What IV solution the medication is going to be in. It gives you the amount, and it also gives you the infusion rate, okay? And here on the right, we have what's available in the pharmacy because depending on what we get in the prescription itself, we may need to compound it using what we have in the pharmacy, right? So, for example, here we have this epinephrine solution at a strength of 1 to 1000 in a 10 cc vial, okay? And then here it tells you the information about the dropper. It's set to deliver 20 drops per ml. Now, if we take a look at this first question here, right, how many milliliters of epinephrine, 1 to 1000, is needed to fill this prescription? Now, whenever you see 1 to 1000, right, that's like a ratio, but there's actually units there. You have to assume certain units. So the 1 is always going to be in gram, okay? The 1 is always gram, and the 1000 is always ml. Now, unless they specify that this 1 to 1000 is, let's say, weight over weight, right? So you're dealing with solids, let's just say, or it's volume and volume, right? So you have a volume of, let's say, a concentrated liquid, right? And you pour it in another volume of another liquid, right? What is the concentration with that, right? So that's when you would get V over V. But if it doesn't have anything, you must assume that it's grams per ml, right? So in this case, we have 1 gram per every 1000 ml. Now, the script is requesting 2 milligrams of epinephrine. And based on what we have in the pharmacy, epinephrine is available as 1 gram per 1000 ml, 10 ml vials, okay? So you have it here, you set it up, is the same as 1000 milligrams per 1000 ml. Now you cross multiply and you solve for 2 milligram and you'll find that the answer is 2 ml, right? So you're going to draw up this 2 ml from the 10 ml vial of epinephrine and then you're going to put it directly into the bag. Now, next question, what would be the drip rate to the nearest full number of drops per minute to deliver 2 micrograms per minute? Now, remember that the dropper is set at 20 drops per ml. Now, 2000 micrograms per 250 ml, right? That's what we have. It's the same as 2 milligrams per 250 ml. You get 8 micrograms per ml. And then you use that to get the amount of mLs you will need if you had 2 micrograms per minute, right? So the question is asking you to get the drops per minute, right? If it's delivering 2 micrograms per minute. So you want to turn this into volume so that you can multiply with the dropper set in order to get your answer, right? So that's what we did here. We got 0.25 ml per minute, right? Based on the concentration of the medication in the IV bag. Drops per minute. So 0.25 ml times 20 drops per ml, you should get 5 drops per minute. Now I know we got exactly 5 drops per minute, but let's just say when you multiplied, you got 4.2, right? You must round up to make sure that the patient gets the whole medication, okay? Unless, let's say, they tell you to do otherwise, I would round up. So if it's 4.3, it will be 5 drops per minute, okay? Another thing is that whatever solution that we draw from the vial and we put into the IV bag, for the practice questions coming up, just know that it's negligible, okay? You don't need to worry about it. So if I take out 5 ml out of a vial and I put it into a 100 ml NS, it's still going to be a volume of 100 ml NS for the calculations, okay? So please keep that in mind. So here they're asking for KCl 5 milliequivalents and 2 ml of multivitamin and 100 ml D5, right? So once again, you check the pharmacy to see how will I get this 5 MEQs of KCl. This is what's supplied. How will I get this 2 ml of multivitamin, right? This is what's supplied. So the multivitamin is pretty easy, right? Take out 2 ml from a 10 ml vial. The KCl, they said take out 5 MEQs from a vial with this concentration, so you don't really know how many mLs it's going to be. So that's when you set up your proportion and you solve for how many mLs is going to be 5 MEQs. You cross multiply and you find that you get 2.5 ml. Now what would be the drip rate to the nearest full number of drops per minute? You go back to the bag itself. So it's 100 ml. And they usually tell you how much they run it over for. 100 ml infused over 1 hour, right? So you're gonna give 100 ml over 1 hour. The question is asking for drops per minute. So automatically, I'm gonna convert this 1 hour into 60 minutes. So I think this was supposed to say every 1 hour or 60 minutes. So 100 ml over 60 minutes is 1.66 mLs per minute. And I did this to allow me to get mLs here and just multiply by 10 drops per ml to get my answer at 17 drops per minute. Pretty straightforward, right? This is another good question here. So once again, they want heparin 8,500 units and 500 ml D5W, but they're telling you to infuse 1,000 units per hour. All right, just give 1,000 units per hour. How will I get my heparin? Well, in the pharmacy, we have this heparin solution that's 1,000 unit per ml. How many mLs of that would I need? Pretty simple, right? 8.5 ml. Next question, which is what would be the drip rate to the nearest full number of drops per minute? Okay, what would be the drip rate? You take the 8,500 units and you put it in 500 ml. Right, the concentration of that bag is 17 units per ml. They want you to infuse 1,000 units. You got to know how many mLs that is, right? So 1,000 units over 60 minutes is 16.6 units per minute. All right, 16.6 units in mLs is 0.97, and then you multiply that by 10 and you get 10, right? Because this is basically 1. So gentamicin, okay, 1 milligram per kilogram. They want you to put this in 50 ml D5W. Pretty straightforward. Once again, where am I going to get my gentamicin from? And even if I know where I'm going to get it from, it's in volume. So how much am I going to draw up? It's right here, 1 milligram per kilogram. You got the patient's weight. Convert that into kilograms. So you need 60 milligrams. Based on what we have in the pharmacy, I would need 1.5 ml. Now, what would be the drip rate to the nearest full number? Once again, you go back, you take 50 mLs to be given over 20 minutes. You don't care about the every 8 hours. You're only given the bag for 20 minutes. Okay? The every 8 hours is just how often you give the bag. But how long do you give the bag? That's over 20 minutes. You do the math, you get 25 drops per minute. Next question. Bactrim. 600 milligrams per 120 milligrams in 250 ml D5 every 12 hours. Infuse over 1 hour. I hope I'm bringing you guys like good variety of these kind of questions, right? It's not like the same type. Each script is like a little bit different, right? So that's good. So once again, where am I going to get this Bactrim? I checked the pharmacy. Is this all we have? No problem. Let's go into the lab. Bactrim is dose based on the trimethoprim, right? The TMP trimethoprim component. Okay. So that's the second number. So that's the second number on the script. So it's 120 milligrams. But when you come into the pharmacy, it's the first number. So it's a little tricky. So it's dose based on that, all right? So in this case, it's like just looking at 16 milligrams per ml. But you need 120 milligrams, right? So you just solve for it. You're going to get 7.5 ml. And you'll find that 7.5 ml will also give you 600 milligrams of the sulfur methoxazole. Once again, what would be the drip rate in drops per minute? Go back. Take the bag, 250 ml. How often they want it? They usually tell you the infusion rate. They want you to give it over 1 hour or 60 minutes, right? You multiply by 10 drops, right? 10 drops per ml, you get 42 drops per minute. So we have 500 ml of a D5 half NS with 18 MEQs of potassium chloride and 6 milliequivalents of mag sulfate. So don't get confused here. There's only 2 active ingredients, right? The 500 ml is just your bag, right? In this case, it's D5 with half an S, so that's a type of bag you may see. They need 18 MEQs of KCl and 6 MEQs of mag sulfate. Okay, so we have this supplied in the pharmacy, and right here they said 4 MEQs of magnesium and 1 ml. Pretty straightforward, right? Set up your proportion. You're gonna need 9 ml of the KCl and 1.5 ml of the mag sulfate. What would be the drip rate to the nearest full number of drops per minute? Once again, they give you the answer right here. Infuse over 12 hours. Infuse 500 ml over 12 hours. How many minutes is 12 hours? 720 minutes. You divide, you get your answer here, 0.694. Not your answer, but that's what you get per mLs per minute when you divide. Multiply by 60 drops per ml, and that's your answer. Straightforward, right? We have another one here, 100 ml of sodium chloride, 3% and D5W over 30 minutes stat. That means we got to do this question fast. Okay, so let's go. So this is what we have in the pharmacy. How many, no. How many milliliters of sodium chloride, 23.4% is needed to fill this prescription? The prescription wants 3%. In other words, what is 3%? That's actually 3 grams of sodium chloride in 100 ml. Whenever I have percent, that's how I convert it, right? Percent means 100, so 3, that means grams. This is all I have in the pharmacy, but if you look closely, this is 23 grams per 100 ml. The prescription is requesting 3 grams. Set up a proportion, 23.4 grams, because it's 23.4% of NS that you have in the pharmacy. You set up the proportion, you get 12.8 ml for you to draw up and put in the bag, and that will give you your 3%. What would be the drip rate to the nearest full number of drops per minute? How much is in the bag? 100 ml over 30 minutes. They tell you the answer. Don't miss this. 100 ml over 30 minutes. You divide it as 3.33 mLs per minute. And then it's set as 15 drops per ml. You multiply, you get 50 drops per minute. Hang in there with me, guys. We're almost there. But you're getting different versions of these questions. If you practice, you should not get any of these wrong. It's so straightforward. Calcium leucovorin injection. We need this much in 50 ml NS and infuse it over 20 minutes. Okay, where am I going to get my leucovorin? Okay, we have some leucovorin powder in the pharmacy. It's 50 milligrams. It's not like we could draw up powder and just put it into this solution. Here, you have to reconstitute it. So you reconstitute it with 10 ml of sterile water for injection. And this is going to be a concentration. So this is what I have. This is what I need. 10 milligrams per meter squared. This is the formula that I use for the body surface area. So my BSA was 2. The prescription was 10 milligrams per meter squared, which is 2. So we get 20. Available leucovorin is 5 ml. So we need 4 ml of leucovorin. What would be the drip rate? 50 ml over 20 minutes. Not 6 hours, folks. Don't you dare put 6 hours. Over 20 minutes. Okay, and that will give you 2.5 mLs per minute. And remember, they told you 20 drops equals to 1 ml. You multiply 50 drops. Easy. And you have 2 active ingredients. How much magnesium sulfate I need? 0.3 MEQs per kilograms. Not a problem. I'm going to get the kilograms here, multiply, and get my answer. How much NaCl I need? I need 0.9%. So if you multiply with the kilograms, you get 6.81 MEQs needed. The max sulfate is available as 4 MEQs per ml, according to what's in the pharmacy for the max sulfate, okay? We get 1.7 ml. For the NaCl, you need 0.9%. 0.9% is 0.9 grams per 100 ml. The NaCl is 4 MEQs per ml. So to solve for how many mLs you need to know the relationship between MEQs and grams of NaCl, and you just literally need to know one of them. 0.9%, 100 ml of 0.9% normal saline has 15.4 MEQs of sodium chloride. And yes, you have to memorize this. There is a way you can actually solve for this. It's longer. If you want to keep things very simple, just memorize this. 15.4 MEQs in every 100 ml of normal saline. Solve for how many ml of available NaCl supply. 15.4 MEQs. Your answer is 3.85. What will be the drip rate? Oh God. Should we even go over this part? I mean, come on. 100 ml. Infuse over 2 hours. They give you the answer. That's 120 minutes. You divide, you get 0.833 mLs per minute. Multiply that by 60 per minute. 60 drops per minute. Your answer is 50 drops per minute. Here we have 250 ml dopamine infusion and NS. Concentration of 1600 micrograms per ml. How much dopamine do we need to add into this 250 ml dopamine infusion to make it? Well, let's see what's available in the pharmacy. We have dopamine solution, and it comes as 80 milligrams per ml, and it's 10 ml, okay? And here we know that the IV set is delivering 60 drops per ml. How many milliliters of dopamine solution is needed to fill this prescription? Straightforward, right? Prescription is for 250 ml dopamine IV solution with a concentration of 1600 micrograms per ml. Okay, 1600 micrograms per ml. So if the whole bag is 250 ml, therefore amount of dopamine in there will be 400,000 micrograms or 400 milligrams. Available dopamine solution is 80 milligrams per ml, and we need 400 milligrams. So therefore, you're going to draw up 5 ml. What would be the drip rate to the nearest full number of drops per minute? Okay, once again, infusion rate is 10 micrograms per kilogram per minute as per the prescription here, okay? The patient weighs 70 kilos. You multiply, you get 700 micrograms per minute or 0.7 milligrams per minute. Now, based on the concentration of the IV bag, for every 1 ml, you're going to have 1.6 milligrams of the dopamine. So if you multiply that, you're going to find that you have 0.437 ml. And if you multiply it by the 60 drops per ml, you're going to get an answer of 27 drops per minute. And that would be the end of this video. Guys, please remember what brings me the most joy is being able to explain difficult topics to others in the easiest way possible for them to understand. So I hope I was able to achieve that today. If this video was helpful, make sure to like, comment, subscribe, and share the video with anybody that could benefit from it. Make sure to connect with me on these social media platforms. Thank you for watching this video, and take care.